You're all very, very welcome. Today I want to share with you some of the findings of a piece of research undertaken as my doctoral thesis, which I was awarded in February. So bear with me. It has been my I suppose, love-hate over the last sort of number of years. So bear with me while I try to share with you some of these findings. What I will do throughout is I have interspersed the presentation with a number of slides, offering you an opportunity just to sort of stop, check out if you're kind of with me, if you've got any pressing kind of queries or issues for clarification or any questions. So otherwise, feel free to use the chat box or whatever, and either Rebecca or Alison will keep me right if there are any questions. Okay. All right, so a little bit about me. As you know, my name is Patricia Nicholl. I am now a doctor of early childhood studies. I undertook my thesis at Queen's University after having retired from the health service after 37 years, working predominantly with children in care. And I was particularly interested in working with children in care. I had a real sense of the difficulties and the challenges for many of these children in education, and very conscious of the differential in educational outcomes for children in care. And it was really because of that work within the sector when I'd spent a lot of time not only in terms of practice and management of practice, but also in the realm of policy and legislation in the Department of Health, but also working with the Northern Ireland Guardian Ad Litem Agency with children coming forward for public care in relation to public care proceedings. Personally, my researcher background was such that I was very conscious of the role of education in as a gateway to social mobility, because I was the first in my own family to attend third level education. I was lucky enough to have been a part of the early intervention transformation project in Northern Ireland, which introduced the Children's Looked After Champion, which is the equivalent of the virtual school head in England and Wales. And so over time, I developed a growing awareness of children's education rights. I developed a growing awareness of the existing data for children in care right across the globe, but particularly in the UK, in terms of that attainment gap, and very conscious that that attainment gap starts as early as primary school and widens as children get older and go through Key Stage 3 into the secondary schooling. So that was my rationale for undertaking the research. Sorry, I'm gonna have to try and move some of these. Yeah, sorry. I was very conscious that in taking on the work, I wanted to look at the education of children in care through their educational rights. I wanted to look at it through the lens of a social justice mechanism, of a set of theories and principles around children's rights, and allowing me to kind of look at the education system possibly as a system which reinforces existing social inequality, and trying to understand, the experiences of disadvantaged groups within the education system, such as children in care, many of whom the education system serves poorly, in so far as it's one size fits all, sometimes can lead to unequal educational experiences and unequal educational outcomes. And I wanted to move away from some of that sense of the personalizing of, I wanted to better understand something around why children in care fare so poorly, and to contribute in a way to our understanding of what works in promoting the education of children in care through an examination of what is today our key policy mechanism for the promotion of the education of children in care in relation to the personal education plan. Okay, a little bit about children in care. Many of you may be familiar with the stats, but children in care come into care for a vast array of reasons, not least issues with regard to compromised or absent parenting. And many of our children in care come into the system as a result of abuse and maltreatment and neglect. In England, we had 83,840 children in 2023, and it was a 2% increase. But in Northern Ireland, we've seen growing in numbers of our child in care population, with the highest number recorded in 2023 since the introduction of the Children Order. And that was very much seen with a kind of steep incline and increase in the numbers of children coming into the care system following the BBP, the Peter Connolly case way back in I think around 2007, and those increased numbers plateaued, but they never reduced. So we now have, on average, around nearly 4,000 children in care at any given time in Northern Ireland. And again, the stats are there for Scotland at 12,500 odd and Wales around 700. So again, just to reiterate, in Northern Ireland, the number of children in care has risen by 35% in the last 10 years and 64% since 1999. So it's a growing number of children in state care for whom we as professionals are charged with the task of corporate parenting, undertaking those significant roles that any good parent would be expected to undertake in relation to the care and upbringing of children, not least the key decisions around where they will live, who they will live with, and issues with respect to their education. Okay, this is really, yeah. Okay, so the background to the research was in the context of that overwhelming evidence, nationally and internationally, that children in care do fare much more poorly in relation to educational outcomes in comparison to their peers. Very few of our children in care experienced children are represented in third level education, with only and with about a third of our children in care leaving school with no qualifications. We know, as I've outlined, that children coming into the care system almost experience a triple whammy in relation to the fact that they are primarily received into care because of issues of maltreatment and abuse. But there's emerging evidence that children are coming into the care system from some of our most disadvantaged areas as well, and that there is a direct correlation between entrance into care and poverty and disadvantage. But not only that, when our children come into care, there's real evidence that as a state, as a set of corporate parents, we're not particularly good in providing stable, continuous care arrangements for children that support their well-being and support their positive outcomes into adulthood. For many reasons, the life outcomes for children in care are generally poor relative to their non-cared for peers. Care experienced adults are often economically and socially excluded and heavily represented in some of our most socially excluded social areas, such as prisons, mental health hospitals, early parenthood, and essentially I was interested in looking at, education as a means of breaking into those cycles of deprivation, breaking into those cycles of inequality, and trying to understand what are the barriers currently to effectively supporting our children in care and best serving them to attain academic qualifications and to progress academically. Okay, so just to reiterate, a lot of our children in care come from some of the most deprived areas in Northern Ireland. 43% come from receiving the care come from 20% of the most deprived areas in Northern Ireland. those are really contributory factors in relation to the care population. Their life outcomes are generally poorer. A third, as I said earlier, leave school with no qualifications, and care experienced adults globally are consistently evidencing poor academic outcomes. Okay, any questions on that to date, which is just a quick cook's tour of the population I was looking at in terms of children in care, in terms of the evidence of their educational outcomes, which I'll go into a little bit of detail in the next slides. Any questions? Folk happy enough? Tumbleweed, I'm going to move on. Okay, so in terms of some of the data, and this is highly contentious data, because in relation to understanding and even collating and analysing the data of educational outcomes for children in care, it is very challenging, because even within the United Kingdom, the data is collected at different points and in different ways. The data has been heavily impacted upon, or data collection, by COVID, when there were long periods of time whenever data wasn't collected and wasn't published. Also, it has been affected in Northern Ireland by industrial action, with many reports around educational outcomes not being submitted for purposes of data collection because of industrial action. So that said, this is the best analysis of the educational outcomes for children in care that I've been able to ascertain. In terms of what this table is telling you about, it's really looking at Key Stage 1 and Key Stage 2 outcomes across what I could gather in terms of the metrics for measurement around reading, writing, and communication and maths. And as you can see, children in care, this section here, the 52% of children, as opposed to 72% of children, 75% of children in the general population in scores in reading. And again, that was England, and then in Scotland, again, it is lower. And that's the same when you move into Key Stage 2, with that gap getting slightly wider. And again, when it comes down to maths, 49% of children in care are attaining their Key Stage 1 in maths, as opposed to 75% of the general population in England. And that then is the same when it comes up to the disparity in Key Stage 2. In Northern Ireland, in our stats, at Key Stage 3, 36% of our children attained the necessary grades at Key Stage 3, as opposed to 71% of children in the general population. And that's a stark difference. Again, can be seen in terms of the difference with regard to maths, with 39% versus 73%. In Northern Ireland, we collect data in relation to educational and attainment in relation to GCSE grades attained at A star to C. And you can see that in Northern Ireland, there was 78% attained their 5 GCSE grades, A to C, as opposed to 92% of the general population. And that then is a wider gap when it comes to maths and English, with 51% versus 78%. And in England, that's wider still, with 7.2% of children in care achieving a grade 5 in their maths or English, versus 40% of the general population. So you can see that by the time children are moving into Key Stage 3, these are sort of 8 to 11-year-olds. By the time they're coming into Key Stage 3, and in readiness for transition into secondary education, the gap in their educational attainment is already beginning to be evidenced. The existing theory as to why this happens is a bit of a smorgasbord, with a raft of theories, which generally boil down to two main things. Either children are failing in their educational attainment because of their personal characteristics, because of issues around pre-care experiences of what has happened to them, and that the system in terms of education and social care charged with acting in the corporate parenting capacity is unable to um, address and intervene effectively in some of those pre-care experiences of trauma and disrupted attachment. Alongside the sense that for some of these children, there's a real sense that the early childhood experiences of adversity, disadvantage, and abuse and maltreatment have in many ways impacted negatively on these children, and that that culminates in a poor coordination of effort, and that there's almost personal failings on the part of the children themselves. Not not least the fact that children subject to special educational needs and disability services are highly represented in the care population. The other side of that coin is that the system is blamed, that the system is not a very good parent, not a very good caregiver, and that the problem is that we, as predominantly the professionals working with these vulnerable children in care, that we are wanting in our efforts and in our understandings of the needs of these children. And that is played out in relation to some of the in-care experiences, which can compound the educational underattainment of the children in care, because many of these children fail to attain permanence in family arrangements and move several times within the care system. And each of these moves bring quite often with it a move of school. So they're changing schools, they're changing friendship groups, they're changing and continuing to experience the disrupted relationships, disrupted attachments with adult figures in terms of those key figures within schools, which all of our research tells us are really important to augmenting the educational outcomes for children generally, let alone children in care. There's some evidence that children in care in themselves feel highly stigmatized by the nature of their care status, quite often failing or not wanting to disclose the fact that they are in care. Often there's been evidence that the care status is perceived almost to have a Pygmalion effect, in that it's any lack of attention or any issues of behavior, because quite often children who have experienced detachment, disrupted attachment, who have experienced abuse and neglect, and being subject to highly traumatic early childhood experiences, quite often that can play out in their behaviors, not least because in many instances the children may be continuing to experience disrupted contact arrangements with family, disrupted decision making in terms of where they're going to be living, and that quite often those behaviours are seen within the school setting as as requiring behavior management, and that's there are times the educational underattainment is regarded as the natural effect of the care status, as opposed to considering some of the trauma informed aspects of this in terms of what is the problem for the child. And this has culminated in high numbers of children in care being excluded from schools. So if the children are disrupting classes, quite often they are excluded or expelled, and that in and of itself, if you're not in school, you cannot be educated. But by and large, in terms of the evidence of what has worked in relation to interventions to support the education of children in care, there's limited evidence of what works. We don't really know what is the most effective means of best supporting children in care. And that was one of the reasons why I was keen to contribute to the understanding of what works in supporting the educational attainment of children in care through an examination of the current policy provision. Interventions that have been tried and tested in relation to promoting the educational attainment of children in care are boiled down to sort of kind of three main areas, and that is really whole systems approaches around augmenting the way in which we as a group of agencies collaborate and work together, providing joint training and initiatives which assist and promote our understanding of the child in care and their adverse childhood experiences and how they might impact on their education. Funding in relation to broad sweeping arrangements for the provision of funds to schools to support the education of these children, and also then the focus of this research, which was the personal educational plan. I'll come on to talk to you about that as the main policy instrument for the support of the education of these children. Other aspects have been linked to working directly with the child and the family in terms of maybe paired reading to support the adult supports for the child, either within the home or within the school setting. Tutoring and mentoring, and letterbox clubs whereby children are provided with books and literature and supported in developing a love of reading and learning. Other school-based interventions have involved the introduction of key roles such as key figures within the schools designed to focus on establishing those very, very important relationships within a school setting to support the learning for children in care. Training initiatives in relation to trauma-informed practice, and we've seen that the growth of joint training between teachers and social workers, particularly looking at supporting the understanding of our professionals in relation to the nature of experiences which have impacted on children in care, which are highly likely to impact on their learning. And also the creation of specialist roles, such as we've seen with the virtual school head in England and Wales, and that's now been mainstreamed in the Children Looked After champion in Northern Ireland. And these specialist roles are also supported by designated teacher roles within school settings, whose job it is to oversee and focus on the data and the issues pertaining to the education of the children in care registered within these school settings in order to promote their educational attainment. Any questions on interventions? Any thoughts, concerns? Are people still with me?
Patricia, sorry, my name's Donna O'Kane. I'm from VOIPIC, Voice of Young People in Care.
Hi, Donna.
Hi, Patricia. I'm just interested. You were talking about pupil premium there. Did I miss what that was?
Well, the pupil premium is a stipend. It's an amount of money which
Right.
is allocated to a school, any school who has children registered within it, who are in care. In Northern Ireland, that funding is determined at a given point of a census point in time. At least it was. I hope it's still the same. But at that census point, returns are submitted from schools in relation to the numbers of children registered who are in care, and an amount of money is then provided to the schools to support these children's education. Now, research across England and Wales, and to a degree, some of our understanding in Northern Ireland is very difficult to ascertain exactly what that money's being used for. And some of the research in England was determined that it was predominantly spent on tutoring, buying in additional tutoring hours for some of the children to support their education. But for some, in some cases, it was just simply used to support the education budget of the schools. It was very hard to ascertain just how well that pupil premium was being used to support the education of the children in care. But it is a source of funding provided centrally from government to support and augment the capacity of the schools to provide additional resource to support the education of these children. Does that make sense, Donna?
Yeah, absolutely. Okay, I'm just trying to then work out,
No,
because
not a problem.
we're working with a lot of kids in care, obviously, and school is always an advocacy issue. And you're looking at what supports are available and stuff like that. So kind of I'm nearly questioning some of the schools is what are they doing, for the child at all time.
And
So
it's not a lot of money,
no,
but there is money provided for each child in care to each of the schools. Again, it is predicated on a point in time, a census point in time, which means that if these children move, and we've already alluded to the fact that sometimes there are a number of placement moves which bring with it concurrent schooling changes, but that funding doesn't move with them. It
right,
is given at the point in time. So if the child moves, a new school won't necessarily get it
right. And does
in
the
that year.
spending of that is determined by the school then? It's not necessarily, as you're saying, it can be amalgamated under the school budget. So the school has,
Yeah. And if the evidence from research in England is that it was predominantly being used to support children through the provision of maybe specialized equipment or buying in tutor hours.
Okay, thank you. Right.
Patricia, in terms of your data, there's a couple of slides and you've moved through them. In terms of Northern Ireland, is it compared? Do we have comparatively good outcomes within the UK, or how does it sit?
It's very hard to make comparisons because of the different approaches to data collection. And some years data is actually missing because of COVID, but also because of industrial action. So it's very, very difficult. The calculations are made at different points in time. Even the educational qualifications are slightly different in different parts of the UK. So it's very hard to draw comparisons. The one thing that you can say is that there is a generic read across all jurisdictions in the UK that there is a disparity and a gap. The gap appears to be wider in England, according to their statistics. But again, some of this data has been challenged insofar as it's much more nuanced than just looking at, the data of educational outcomes and how do they compare with, the educational outcomes for children in need, for children on the edge of care, and not just the children in care, because at a point in time, there was a sense way back in the early 2000s that, and I think the PEP, the Personal Education Plan, was almost introduced as a part of that movement in terms of, these children are being failed by the system. And what are we doing, and how can we as professionals be made to better support these children? And so I suppose the data in itself is problematic. It really, I wouldn't hold much store except to say it's there to provide a generalized perspective on the fact that we cannot get away from some of the stark figures that the educational outcomes generally are poorer in relation, and that's a read across many Western countries where we're gathering this the nature of this data, and I wouldn't necessarily go as far as to say that they're any better in Northern Ireland. We're no better in Northern Ireland in having care experienced children enter third level education than any other part of the UK. That answer your question?
Does, yes, thank you. There's a couple more
Oh.
questions there on the chat. Sorry, I'm just, I don't know, can you see the chat, Patricia?
No, but go ahead.
So I'll go, Anthony, about the methodology, the research advisory group. Could you tell us a wee bit more about this membership?
Well, I'm gonna come on and talk about that, and I'll maybe address that. Yeah. Okay. When I talk, yeah. Okay. I'll move on and talk about some of that then. Because first of all, before I talk about what I did in terms of the methodology, I wanted to talk about just making sure that folk understood what the personal education plan is. And the personal educational plan is basically a standardized plan for all children in care of statutory school age. So if you're a child in care, you can expect, once arrangements are being made after the first 3 month statutory child in care review, that you will be subject to a personal education plan. That is the guidance. In Northern Ireland, the personal education plan is guidance only. In England, and Wales, I think, it is a statutory requirement. In Northern Ireland, with the new Adoption and Children Act, there is a plan to develop regulations which will put the personal education plan on a statutory footing and introduce a requirement for all children in care to have a personal education plan, and will outline the nature and type of the expectations and requirements of that personal education plan. But essentially, as it is now, it was introduced in Northern Ireland in 2011, and further revised guidance for primary schools was issued in 2023. But essentially, it aims to support the educational needs of children in care through enhancing multi-agency working and promoting the voice of the child in the personal education planning process. And the idea is that the plan would introduce clear targets, planned actions to respond effectively to the needs of these children within school settings, to provide a continuous record of their academic achievements. And this plan, designed to support their educational needs and to support their educational progress, should then contribute to the overarching planning instrument, the statutory reviews for all children in care, which take place on a 3-monthly basis and then a 6-monthly basis thereafter for every child in care. So the idea is that this is the main planning vehicle to support the education of children in care in Northern Ireland. So I was interested in, well, just how effective is it? Because if it's been, the education of children in care has been a subject of, political debate for some time. And since the personal education plan was introduced in 2004 in England and in 2011 in Northern Ireland, there hasn't been what I would have regarded as a tremendous swell of or shift in change in terms of those educational outcomes. So I was interested in understanding, well, what are the views around its effectiveness? What are the barriers to its effectiveness? Just how effective is the personal education plan in supporting our children in care? So my research questions were about, what are the current legal, policy and practice initiatives for supporting the educational rights of children in care? What are the views and experiences of teachers responsible for the educational attainment of children in care of personal education plans? What are the experiences of those teachers regarding multi-professional collaboration in respect of personal education plans? To what extent are teachers aware of and informed of children's educational rights? And are there more suitable practice models that might better support children in care to achieve their potential in education? So the research was a qualitative piece of research, constructivist in its design. And that means it essentially, there was a sense that the reality on the ground of how the personal education plan is working, how it was being implemented, I really wanted to get a sense of that reality from those closest to its implementation. Now, it has to be said at the very outset, this research was heavily impacted upon by COVID. Insofar as I am gratified for the support of the Department of Education and the Children's Looked After Research Education Project, because I was able to gather the data from teachers, having originally sought to gather the data from teachers, social workers and children. But unfortunately, when COVID emerged, that was just simply not possible. So I am really grateful for the fact that I established a piece of data collection through the support of participants in primary school. And I was interested in working with primary school teachers, not least because, as I said earlier, the evidence is that that education gap for children in care starts in primary school, broadens by Key Stage 3 and widens in secondary education. So I was interested in the understandings of primary school teachers of the effectiveness of the workings of the PEP, the effectiveness of the PEP in augmenting the voice of the child, the effectiveness of the PEP in supporting multidisciplinary, multi-agency arrangements in supporting our children in care. And in doing that, I was very conscious in terms of my own researcher positionality of being a social worker. Now, as a social worker, I was very clearly involved in interviewing teachers. And for that reason, I was coming from that perspective of nothing about without. And so I wanted to create a research advisory group. And I hope this answers Anthony's question around just bringing in people, experts, people from the education sector, people who had experience of working with children in care and their education, people who had experience of developing policy and advocating on the part of children in care and their education. So for that reason, I established a research advisory group designed to support me really in relation to designing the data collection instruments, the semi-structured interview schedule, and the interview schedule for the focus group of teachers thereafter. And that research group, by and large, comprised of a group of professionals, predominantly from the educational sector, who could support me and assist me in getting even things like interprofessional language right. They supported me in generating the questions to be asked in the semi-structured interviews. Then when the interviews were completed, it was through the presentation of those early findings of the semi-structured interviews that the research advisory group then supported me in putting together the nature and type of the questions that we wanted to delve into a little bit more deeply to ascertain a more rich, nuanced understanding of what might be happening within the personal educational plan implementation and affecting its impact and its effectiveness, and ultimately the supports for the children in care that we work with. So I interviewed 20 primary school teachers. These were primary school teachers who were purposefully selected, and a purpose of sample is simply a sample that required to meet certain criteria. The teachers must have experience of working with children in care and working with the personal education plan. Those were my criteria for inclusion in the sample. All of the school types within Northern Ireland in terms of Catholic maintained schools, controlled schools, integrated schools, and one Irish medium school were involved, with about 10 Catholic maintained, 8 controlled, and 2 integrated schools. And then these schools were representative of all of the trust areas, the entire geography of the north of Ireland. And the participants, by and large, ranged in experience, but the bulk of them had between 6 and 10 years experience of working within these primary schools and working with children in care and the personal educational plan. So I undertook the semi-structured interviews with these teachers, all of which were undertaken online due to the just emerging from COVID, and the schools were just reopening. And following the analysis of the initial analysis of the semi-structured interviews, a small focus group with a smaller sample of teachers were then undertaken, and these findings were then analysed using Braun and Clark's thematic analysis and a kind of in vivo, a kind of an approach to the analysis of qualitative data was used to support the themes and the emerging thinking around what was generally the consensus of this participant group in relation to the effectiveness of the PEP. The findings were analysed through the lens of a French sociologist, Pierre Bourdieu, and his theory of social reproduction. By and large, thinking about it from, a rights-based social justice perspective, and my interest in whether the education system, serves to address and ameliorate issues of disadvantage, or serves to promote, social inequality. And so the lens of Pierre Bourdieu, using his concepts of field, habitus, and capital, alongside a children's rights perspective, really were used to analyse the data and discussed in terms of recommendations for a much more children's rights based oriented and child-centred approach to the personal education plan process. Okay, a little bit about Mr. Bourdieu. Influenced sociology of education. His concepts illuminate educational disparity, and his consideration of education issues determining social mobility. Okay, he argued that inequalities are socially reproduced not only by the economic capital of the students and their parents, but also through the social and cultural capital. And according to Bourdieu, intelligence is overlooked by trivial factors such as accent, tastes, experiences, perceptions, and dress. Okay, so he talks about a set of thinking tools called field, habitus, and capital. And in this thesis, the field was very much being examined as an understanding of the personal education plan and the social and educational milieu and the planning fora, of looked after children's reviews, very much seen as fields within Bourdieu's theory, fields within which actors and participants struggle for power, fields within which there are different dimensions of relationships, and they are all heavily predicated on the capital that any individual professional would bring to that field, and also their own personal dispositions, histories, their past experiences and attitudes and approaches, all forming the habitus of the professionals within that group. And my research was really just looking at some of his concepts around, is there symbolic violence occurring within the personal educational planning process? And that is characterized by unfair treatment or the limiting of opportunity or researches in relation to any of the individual children in care. And the concept of misrecognition, are processes prevailing within our personal education planning processes, which we're failing to recognize and we're taking for granted as the way things are done, the common approach and discourse to the management of the arrangements for the support of the children in care. But are these being misrecognized as actually symbolic violence and disregarding some of the real issues and needs for the support of these children in care? Okay, I was interested in a rights-based approach. Is the personal education plan evidencing a rights-based? So I'm just going to check it. I haven't skipped a slide. Okay, I was interested in the personal education plan as a rights-based approach. How effective is it in promoting the educational rights of children in care? Is it if what social work is all about is about promoting social justice, how well equipped is the current policy in Northern Ireland supporting the education of children in care from a social justice rights-based perspective? And so I wanted to focus on that approach to rights, not least because of my own professional training as a social worker, working with disadvantaged groups and their rights. But I wanted to foreground those issues of education as a part of a rights-based agenda. And so the research was predicated on the UNCRC and my understanding of the the duties that are imposed upon all of us as professionals to support the realization of the rights of the individuals that we serve, and to ensure that we support rights holders, the children themselves, to claim those rights. And so I was looking at particular issues around McPherson's model, around definitions of rights-based approaches which incorporate participation, non-discrimination, interdisciplinary collaboration and accountability. Okay, any questions on the methodology to date? Any, I know, Anthony, did that answer your question on the research advisory group and its role?
Yeah,
Not
that's
sure.
great, Patricia. Thank you. Thank you, Patricia.
Great. No problem. Thank you.
Natalie has put on a little question here. Do you think secondary grammar schools need to change? Less subjects until the second year. As private schools, no change, especially for looked after children. To help.
Do I think secondary educational teaching needs to change with fewer subjects until
second year?
Second year.
Natalie, maybe do you want to ask the question? You might summarize it a wee bit better. No, I'll just read it all out.
Oh, sorry. No, I was yeah, sorry, I've worded that badly. Sorry. I'm just trying to decipher. As private schools, there's no change within the private sector in various countries, and then sorry, should have been a comma, and then especially for looked after children in regard, like that's another point. That's another point. I was just like wondering, do you think there would ever be any like change in the future? With the implementation of the national curriculum and of the state and education system, and maybe there would be adaptation needed if there is inequalities, because everybody is equal and those individual children who are looked after have to also have access, and they have to be accommodated. It just maybe will not continue, hopefully. So maybe there would be a change, because there is a lot of changes going on within the family. Any sociologist would know that. And maybe these inequalities could grow more, manifest more.
I suppose in a nutshell, I'm not really able to answer your question, and I suppose because not being an educationalist per se, I have no real understanding of any planned changes to the curriculum, or what I am committed to is inclusive education and the capacity which requires, the commensurate funding to enable our educational system to be flexible enough to be able to meet the needs of all children from a diverse range of backgrounds with a diverse range of needs, and that sense of shifting away from a one size fits all for large cohorts of children in classrooms. Yeah, I think we're possibly not particularly good at ensuring that our education system meets the needs of those children who have very different backgrounds and very different needs for support within the education sector. So I'd be coming at it really not from the point of view of curriculum change or delimitation of the subjects. I'd be coming at it more from the point of view of understanding, awareness raising and training around a consensus of sort of maximum flexibility within the education system. And that's no easy ask, I appreciate. Does that answer your question, Natalia?
Yes, no, thank you. It's got my thinking cap on there. Thanks a lot. Thank you.
Okay, thank you. Okay, I'm going to move on to my next slide now. And that's really moving to the themes and the findings and the outcomes of the research. Okay, These themes boil down to 4 main pillars. Looking at the, hold on, excuse me a second. There's someone that's just come in and is making noise in my kitchen. Excuse me. This is being recorded. Sorry, I've just been interrupted. Shouldn't have done this at home. Okay. Essentially looking at 4 pillars. The personal education plan as in terms of its performance, the personal education plan as a performing PEP, the personal educational plan as a partnering PEP, how effective is it in promoting, maximizing and optimizing our multi-agency collaboration, the personal education plan as a participative PEP, how effective is it in augmenting the voice of the child within the processes, and the personal education plan as a rights promoting instrument. And so when we look at the first instance, the performing PEP, really issues emerging from conversations with primary school teachers in my research, overarching sense that the personal education plan, in terms of performance, it lacked impact. There were issues with regard to problems with regard to ownership and understanding of the purpose of the personal education plan, and issues with regard to a lack of oversight and accountability. So there was a sense from the teachers that I spoke to that while there was a real sense that the personal education plan was important, and there was importance attributed to the personal education plan, it was not matched with a sense of consensus around the effectiveness of the PEP. Many of the teachers, over 50% of the teachers, had received no training in personal education plans. The way in which personal education plans were being implemented were highly patchy and inconsistent, and there was a different rollout of the policy and the implementation with regard to the personal education plan than was ever envisaged in the guidance. And there was certainly evidence from the participants that the personal education plan bore little relevance in contributing to planning for children in care and their educational outcomes. For majority of the teachers, they'd never seen a completed educational plan. For the majority of the teachers, they were attending children's looked after reviews, and to which the personal education plan was never mentioned. And rarely was there a sense that it was anything other than a paper exercise, a tick box exercise, bearing little import. So there were differences in the policy intent versus the reality, with diverse practices. Many of the teachers never having attended a personal education planning meeting, and yet real consensus among those who had about the transformative benefit of these. But for the teachers that I interviewed, many had never attended such a meeting, and when meetings did take place, they tended to be organised on a unidisciplinary educational basis within the schools themselves, but did not reflect the multi-agency nature of the planned and policy intent in terms of having people involved, multiple agencies involved in those meetings. So there was a sense that the PEP was ineffective in contributing to wider planning for the child, and that it lacked really targeted, smart objectives, that the PEP had no oversight and no sense of anyone being accountable for it, and that each child in care required to have a set of targets and goals which were more regularly monitored and overseen in relation to their compliance and their actual impact on the support for the child's educational progress. Some of the quotes in terms of performance. There's a really important role for the PEP. It's about creating a team around the child that everyone's working with or involved with the child, is actually keeping the child at the centre. Many who'd been involved in the transition PEPs, and that's through the Children's Looked After project, think they'd been really effective. But for others, it was a paper exercise, a tick box procedure that gets completed. Is there any real credence given to it? I personally think schools are probably doing a good bit of it anyway. So there's bits of the PEP that overlap to what schools are already doing. In order for it to be actually effective, it would need to be more targeted with measurable targets that were achievable and purposeful. I think there needs to be more social and emotional content. A huge section of it is all related to key stage assessment. And I do think that key stage data is just farcical. It doesn't tell you anything. So there's a real sense that from the point of view of the capital, the knowing of the child and the child's educational needs and what might best support the child to progress academically, there was a real sense that there was a focus on academic targets rather than really important information around the social, behavioral, the emotional, and the trauma-based experiences of these children, which of course were critical to their educational outcomes in terms of best supporting these children within school settings. In relation to partnering, there was a sense that for participants, the personal education plan had been heavily impacted by COVID, not always to the detriment. So there was some real evidence of the benefits of COVID in the creation of online platforms for communication and support groups. There was a sense that the personal education plan suffered from serious issues around professional tensions and power differentials, with some confusion around role and understanding of the role of each other, and a real sense of training needs for the professionals involved in it. For those participants I interviewed, there was a real sense of the benefits of collaboration, that those participants who had been involved in multi-agency, multidisciplinary meetings considering the educational plan for the support of a child in care found it so beneficial, so transformative. There was a real sense of the commitment of these teachers to enhancing the life chances of these children through educational attainment, but there was an overarching sense that the multi-agency work arrangements were not working effectively. There was little evidence of change or improvement since the introduction of revised personal education plan guidance in Northern Ireland in around 2018. And there was, more importantly, a sense that for teachers, they occupied a subordinate position within the field of the personal education plan and the LAC processes. They were very conscious of the need for more information on social and emotional and behavioural issues with regard to the children, and yet they were only being asked to provide information around academic targets, around key stage 1 and 2 and 3 information data, around the nature of that type of information. And so there was a real perception that the learning needs of these children was not being addressed in terms of the emotional work of the personal education plan. There was a sense that for teachers, they were their voice was subordinated within the personal education planning process. For teachers, there was a sense that the PEP was owned by the social workers, that it was the social workers who organised the meetings, and irrespective of the revised guidance requiring teachers to do so in the education sector to arrange the meetings, there was little sense at the point of data collection of that having become embedded practice, and a real sense that for some teachers, they felt a lack of confidence and competence in working with the emotional and social needs of these children in care, and that in some ways it was the social workers who were seen to be these strong emotion workers who had a greater level of capital in the understanding of the looked after world and the understanding of the nature and type of the meetings and the information that was required. So those tensions and multi-professional understandings of the knowing of the child and the apparent privileging of academic attainment scores and the subordination of knowledge of the social and emotional capital relevant to the child's academic attainment serve potentially to undermine the holistic nature of any plan to support the education for children in care, their educational attainment. And so there's a real sense that these children, in terms of symbolic violence, are being set up to fail due to the insufficient knowing of the child in terms of the social and emotional issues potentially impacting on their learning. Some of these quotes: PEPs done well and done right give added value to schools because they get information in a PEP that you don't really get in any other venue. I think I struggle with the lack of communication between health professionals and ourselves in education, but I'm not sure maybe the PEP's the right way. The pandemic has improved the responsiveness and the availability of social work support. Yes, and the reason for that is because of how we communicate now, email as opposed to telephone contact. One of the things that has come out of the whole lockdown over the past number of years is that the first time ever in education is the sharing of information through schools is unbelievable. There's a large part of this form lends itself towards academic attainments. That needs to be something more specific for the likes of that child to help them, supports that he or she could benefit from in terms of the trauma and psychological support in relation to their education. I think we're great at the whole meeting their educational need, but emotionally, guidance for us actually would be quite good, or even beyond guidance, some sort of training. I think there's definitely a gap there. What should we as educationalists expect to get out of this consultation with a child? How do we approach it sensitively? There's probably a lot more involved than I thought. Maybe initially a lot more training is maybe required to approach that. When we came to talking about the PEP as a participative instrument, bearing in mind that issues of participation go to the heart of rights-based approaches and practice, the PEP was evidence to be fraught with exclusionary practices and the privileging of adult voice, by and large predicated on issues of paternalism and protectionism. There was a recognition across all participants that child participation was really important, and that there was a need to create, that in so doing, involving children, that would create an authentic PEP process. But there were real tensions between the rhetoric and the reality, and that children were routinely not invited to participate in their PEP. For those participants interviewed, there was a sense that was in many instances to do with the perception of the child's age and maturity, and also the training needs of the children, of the parents, of the teachers, because the teachers felt ill-equipped to deal with the social and emotional issues prevailing for a child in care, and were fearful of doing further harm, and were very protective of these children in terms of the conversations that might have to take place in a personal education planning forum that might potentially adversely impact on the child. And there was a serious issue around personal education plans not facilitating the voice of the child, and that even in the context of rights respecting schools, where 25%, about a quarter of the schools participating in the research were rights respecting schools, and there was no difference between those schools and the other primary schools who had not signed up to that program, a UNICEF program for respect of rights within primary schools. There was no difference in that these schools were not any more likely to be involving children in care in their personal education plan. So there was a real sense that the adult voices were being privileged, that children were seen to be objects of decision making rather than active participants with a voice in the educational decisions or decisions about the supports for their education. And that embodied habitus of child exclusion and adult voice reduced the symbolic capital of the child, and thus impaired the plan, with a real sense that certainly, because the participants felt that it was important to involve the child, that some thought should be given to a raft of ways of imaginatively involving the child and ensuring that their voice was heard in a raft of different ways without necessarily being harmful or creating any further disadvantage for the child. Some of the quotes, I suppose it's hard because it's an official document. It's not really child friendly, the actual PEP. So unless there's some way for older children of making a version of it, the voice of the child probably isn't being listened to enough to date. Well, I think it would be very important, but as I say, we haven't used the PEP as an opportunity to discuss with the child. Well, I suppose they are consulted. They're not consulted by us in school. That's a strand of the PEP, isn't it? Their contribution is sought, and it's a social worker who had to do this. When I'm completing those forms, I'm not involving the child in that. And is that more because it hasn't been recommended that I do? But yet, as a rights respecting school, I should know to do that. The majority of teachers are never going to have a child with a PEP, only going to be some every now and again. There's a need for training and awareness raising for teachers in relation to the personal education plans. Some schools may never have them, i.e. children in care at all. How do you ensure the system has an ability to support them, to tap into something if you have an issue? I think depending on the age of the child as well, the older the child, the more capable they are in contributing to what they see as their targets. But probably in P1, 2 or 3 may be able to, but I can't really see a P1 or P2 child being able to make a contribution to that. So, in relation to the personal education plan as a rights promoting PEP, it was seen as a weak reflection of a rights-based approach, not least from what I've discussed earlier in relation to multidisciplinary integrated working and the participation of those most affected and impacted by it, and also the lack of accountability and oversight. But there were variable understandings of the rights and professional responsibilities for the children, for the personal education plan, and there was limited training of the professionals in relation to education rights or rights generally. There was a tenuous acknowledgement within the participants group that children's rights within the PEP reflect that they should be reflected within the PEP, and they reflect a differential between the rhetoric and the reality in respect of the participation of children in the PEP process, while all participants felt that there was an important aspect to the PEP in ensuring it reflected children's rights. And there were some clear examples of schools focusing on educating children for literacy around their rights. There was a real variability in the understandings of children's education rights, and there was limited training, including the training of those participants within rights respecting schools. So rights were not routinely and explicitly considered as part of the PEP. Some of the quotes from the findings around the promotion of rights in the personal education plan, I think they're critical. We want all children, no matter what their gender, race, religion, social background, to have the same opportunities. No, I don't think that the PEP considers children's rights well enough. The form that I have at the minute is 12 pages long. About 6 of those pages, there's no elements of it that I have to flick through. So post-16, special and additional educational needs, well, I don't need that because my child is not post-16. Suspensions, expulsions, I don't have that. Expelled, and then I have residential care home supports and so on, so on. Some sort of child-appropriate, age-appropriate template is needed that seeks their views in a less clinical way. And we can do this. No, you can't do that because nobody wants to sit beside a child and go, let's tick what you can do, can and can't do. I suppose it's an area that we're all learning about, really. It's a relatively recent journey, and there probably is going to be adjustments. Needs to be both planning and implementation in schools as we learn more about the benefits of really respecting children's rights and taking that into account when we're making decisions. So, in conclusion, my research determined that the personal education plan and the personal education planning process is a field of struggle, characterised by professional power differentials with confusion around the purpose and the ownership of the PEP, the privileging of academic knowledge of the child over emotional and behavioural issues, with habitual dispositions of professionals adversely impacting on the knowledge and information of the child, which contributes to their educational planning. Children in care being potentially set up to fail due to the insufficient knowledge of the social and emotional issues impacting on their learning. And the violence therefore occurs in the unjust subordination of individuals, and also the tacit acceptance of this subordination, the silencing of the voice of the child, the privileging of the voice of the social worker over the teacher, and that tacit acceptance of those arrangements and those relationships, coupled with the misrecognition of those extant power relations, was very important. So my thesis argues that the PEP doesn't necessarily constitute an empowering rights-based approach reflective of social work professional values and the UN principles of participation, discrimination and accountability. It's very hard to see how the best interest of the child can be seen to be upheld when the child's voice is not being routinely sought and heard and acted upon. The application of Bourdieu's triad of concepts to the data raises concerns about symbolic violence or the unfair treatment of children in care in the PEP process in Northern Ireland, not least by their exclusion of their voice and the subordination of some really important information around social and behavioural issues that might best impact on the planning for their supports for their education. This is exemplified by the findings of adult-centric, paternalistic, protectionist, exclusionary practices subordinating the voice of the child, privileging academic, target-driven knowledge over social and emotional knowledge of the child, and encompassing professional power differentials in the personal education planning process. Participation is a keystone in the Convention on the Rights of the Child, but the findings evidence limited compliance to Article 12, those obligations suggesting a lack of a systematic application of the best interest principle in relation to children in care. The findings of that developmentalist, risk-orientated approach whereby children of young ages were not seen to be capable and agentic enough to provide information that might inform their plan for their own educational supports, and a sense of the concerns about the emotional nature of some of the information that might be discussed and the potential impact on them. That impacted on children's participation in their PEP because of their perceived vulnerability and concerns that involvement might be detrimental to their well-being. And these stereotypical assumptions about young children's capabilities to contribute to decisions about their educational supports perpetuate potentially the power imbalances in creating adult-centric practices and the oppression of our children in care in educational settings. The findings do, however, emphasise the complexity of participatory practice, stressing the need to avoid tokenistic approaches in child participation in their personal education plan, and suggest the requirement to design those approaches and to foreground the position of the child on an individualised basis in the offering of support for children and the contribution to the PEP process in whatever way suits them, and not a one-size-fits-all. And it is essential that teachers are trained in balancing those participation rights with their rights to protection in addressing the educational needs of children in care in a sensitive and non-stigmatizing way for all professionals. The findings of the PEP as a bureaucratic exercise with limited impact on the planning for the educational supports for a child in care call for a much more child-focused, child rights impact and educational outcomes approach. Findings reinforce Macpherson's call for enhanced accountability and transparency in practice, policy making and evaluation, and ensuring that any developments in the personal education plan are developed through a process of critical reflection against human rights standards. And it reinforces the need for individualised needs-led support for the education of children in care. And I suppose establishing and ensuring that all children have smart targets, and that's a core element of the personal education plan. So as Liebo et al. Argued, individualised planning against clear goals for children in care, particularly those with special educational needs and disabilities, supports that social justice ethos critical for the realisation of educational rights, and the findings evidencing a privileging of academic information over issues of trauma and emotional need potentially undermine the trauma-informed pedagogical approaches designed to support the diverse educational needs of our children in care. So the study findings characterise the PEP as a paper exercise, with teachers having limited influence and power in the PEP processes, which are regarded as the domain of social services. The findings that the PEP fails to appropriately inform the educational aspects of a child care plan are significant. The findings outline significant training gaps in respect of the PEP and a lack of clarity or ownership of the PEP and professional roles and responsibilities. They resonate with previous research wherein there's a real risk that if no one is in charge, everyone's in charge of the child, and therefore no one takes responsibility. The findings reflect some of the evidence that Waterman found the professionals didn't regard the PEP as an essential component of the system of educational support for children in care. And the evidence of the incoherent approach to effective multi-agency planning and concerns about the reported tensions within the system around the child in the areas of knowledge of the child in terms of the foregrounding of academic attainment results over issues of social and emotional and behavioural information. Those academic progress scores, while important, it is absolutely important that the PEP process encourages professionals to work together and to take account of a holistic information around issues potentially impacting on the child's educational progress. Those power differentials within the multi-agency system supporting the educational needs of children in care raise concerns about the educational rights of children in care and how they can effectively be realised in the context of certain professional groups perceiving themselves to lack power within the system. The findings echo those of Atkinson and the OECD report in relation to deficits in collaborative effort in the support of the educational attainment of children in care and reinforce the data on challenges in securing corporate parenting decisions designed to best support the education of children in care. Okay. This perceived skill deficit among some teachers in addressing the sensitive issues pertaining to children in care and their educational needs, while simultaneously acknowledging the need for more trauma-informed PEP processes need to be actively attended to, with training for all professionals in managing the social and emotional issues emerging within the PEP context for the support of the education of children in care. And there's real evidence that in many instances teachers do feel a sense of a lack of competence and a lack of confidence in dealing with the emotional aspects of the supports for children in care. So they require to be teachers require to be supported and they're required to be trained. And this attests to the literature, extant literature attesting to the perceived gaps in training in the provision of mental health and trauma-related information and support for teachers. And that serves to exacerbate the perceived separation between care and education, which already has been identified as a major factor in the poor academic attainment of children in care. So the findings reinforce the international literature asserting the need for better support of multi-agency practice. They emphasise the need for collaborative planning and provision between education and social services in addressing the holistic needs of children. All professionals working with children in care require to be skilled and supported in the management of potentially sensitive and emotional responses and contributions from children in order to demonstrate the necessary rights-based approach which considers children as competent individuals. The way forward essentially was in some ways simple in that there was a sense that the personal education plan could be rendered more effective, more impactful in relation to both partnering, rights promotion, participation, and performance if we applied full adherence to the existing PEP policy. So there's a real sense that the current policy was fit for purpose, but it was that the implementation of that was so patchy and inconsistency that should be addressed, and that should be addressed by having full oversight and clarity of ownership of the personal education plan and accountability for those plans in terms of ensuring that they actively impacted on the progress of the child in care in their education. There was a sense that we could optimize technology to reinforce the regularity of those multi-agency meetings, which when they did happen and individuals who were interviewed experienced them, felt were really, really positive and advantageous, not just to the professionals, but to the children themselves. And that we introduce a range of flexible approaches to facilitating the child's voice. There was a real sense that for some schools, because they very seldom would experience having a child in care registered in the school, there was a real sense that there was a need to introduce and establish communities of learning whereby schools who regularly have children in care registered and are using the PEP processes, that they could offer their services and that there could be a mutual collaborative learning approach within these communities of learning. developed, and that in facilitating the voice of the child and effectively promoting the child's agency, a more democratic citizenship approach would be promoted with equal decision-making power. There was a sense that the PEP could more specifically reflect children's rights in the form. The Article 12 rights should be much more, or should be augmented within the PEP process, and that commensurate with the augmentation of those rights, that higher support, awareness raising and training for the professionals involved in the PEP was required, along with enhanced training and capacity building for professionals, particularly in dealing with the social, emotional and behavioural issues which are prevalent in dealing with personal education planning for children in care who have experienced issues of trauma and adverse childhood experiences. And then in so doing, we would augment the status of the personal education plan in the overarching care planning process for children in care.